Welcome back to the 6th video in our T-cell series. Hi, I'm Christopher, and this is the final video in this set, and this is where the whole story pays off. We started with how T-cells recognize antigen. Then we talked about thymic selection, MHC presentation, CD4 and CD8 roles, and clonal selection. Now we are going to focus on immune memory. Immune memory is the reason that the immune system improves with experience. The first time the immune system encounters a pathogen, it has to start with rare naive cells. That means it has to find them, activate them, expand them, and turn them into effectors. And that takes time. But after the first response, some antigen-experienced lymphocytes remain behind as memory cells. So when the same pathogen appears again, the immune system is not starting from scratch. The second response hits faster because the immune cells already exist. Let's begin with primary response. A primary response is what happens when the immune system encounters an antigen for the first time. The problem is not that the immune system is lazy. The problem is that it starts with very few matching naive T cells. First, antigen enters the body. Then antigen-presenting cells capture and process it. Those APCs present peptide MHC complexes to naive T cells, often in the lymph nodes. The vast majority of naive T cells will not match that antigen. Eventually, the rare matching T cell is found. It receives activation signals, including co-stimulation and cytokine support. Then it undergoes clonal expansion. Only after that expansion do enough effector cells exist to produce a strong adaptive response. And that is why primary responses take days. The immune system is building a specific army from a tiny starting population. Now let's compare that with secondary response. After a primary response, the antigen-specific memory T cells remain. They are not naive anymore. They are antigen experienced, and that changes timing dramatically. When the same pathogen appears again, the immune system already has a larger pool of cells that recognize that antigen. Those memory cells can activate more quickly, expand more rapidly, and generate effector function with less delay. So instead of spending days just finding and building the response, the immune system can move faster. And that's the whole advantage of immune memory. The second response is not magic, it's logistics. The right cells are already there, they are more numerous, they are easier to activate, and they are already partially prepared to become effectors. This slide summarizes why memory responses are faster. Compared to naive T cells, memory T cells have several advantages. First, they are more numerous than the original rare naive clone. After clonal expansion, most effector cells die, but the remaining memory pool is still much larger than the tiny starting population. Second, memory cells are antigen experienced. They have already gone through activation and differentiation once. Third, they often require less co-stimulation than naive cells. That does not mean memory cells ignore all normal rules of activation. They still respond to antigen and signals from the immune environment. But their activation threshold is lower, so they can respond more efficiently. And fourth, they can differentiate into effector cells faster. The practical comparison is simple. Naive response, rare cells, slower activation, slower expansion. Memory response, more cells, faster activation, faster expansion. That is why a vaccinated or previously exposed animal can control infection more quickly than an animal seeing the antigen for the first time. This is where vaccination fits into the story. Vaccination is not just about putting antigen into the body. The goal is to create immune memory safely before the animal encounters the real pathogen. The vaccine introduces antigen in a controlled way. APCs present that antigen, Naive lymphocytes that recognize the antigen are selected and activated. Those cells expand, differentiate, and generate memory T cells and memory B cells. Then later, if the real pathogen appears, the immune system behaves as though it's already seen that threat before. It is not starting from a tiny naive pool, it is starting from memory. And that means faster recognition, faster expansion, faster antibody production, and more rapid effector responses. Vaccination turns a dangerous future first encounter into a faster, stronger memory response. That does not always mean sterilizing immunity or zero clinical signs, but it often means better control, less severe disease, and a much better chance of protection. Now let's make this clinical. Imagine an unvaccinated animal encountering a pathogen for the first time. That animal has to mount a primary response. The immune system has to find rare naive cells, activate them, expand them, and generate effectors. During that lag period, clinical signs may worsen before they improve. Now compare that with a vaccinated animal. The vaccinated animal has memory cells already present. When exposure occurs, memory cells can respond faster. They expand more quickly, generate effectors sooner, and help control infection before the pathogen reaches the same level. The clinical result is often milder disease, shorter duration, or prevention of disease altogether, depending on the pathogen, vaccine host, and exposure level. This is the immunologic logic behind vaccination. The vaccine does not need to change the basic immune tools. The animal still uses antigen presentation, T cell activation, antibody production, and effector responses. Vaccination changes the starting point. Instead of starting from naive cells, the immune system starts from memory. After the threat is controlled, the immune system does not need to keep the entire effector army forever. That would be wasteful, and it could increase the risk of ongoing inflammation or tissue damage. So the response contracts. Most activated effector cells undergo apoptosis after the battle is won. This is normal. This is not immune failure, it's immune cleanup. But some cells survive as memory cells. Those memory cells persist long term and give the immune system a head start the next time the antigen appears. What a beautiful compromise. The immune system eliminates what it no longer needs, but keeps a record of what might matter again. Most cells die, some remember, and that memory is what makes future responses faster and more effective. This final map brings the entire series together. First, ask where the antigen is located. If antigen is inside a host cell, especially from a virus replicating inside a cell, think endogenous pathway, MHC1, and CD8 cytotoxic T cells. If antigen is free, extracellular, or taken up by an APC, think exogenous pathway, MHC2, and CD4 helper T cells. If bacteria persist in vesicles, CD4 Th1 responses and macrophage activation become especially important. Then ask whether this is the first exposure or a memory response. A primary response starts with rare naive cells, so it is slower. A secondary response starts with memory cells, so it is faster. That means immune reasoning often comes down to two big questions. Where is the antigen, and has the immune system seen it before? Location predicts the pathway predicts the T cell response, and memory changes the speed. Thanks for watching. I'm Christopher Lee, and what you understand today helps you protect patients tomorrow. And I'll see you in the next video.